We're going to go ahead and get started. I'm Marko Vujicic. I'm the Chief Economist at the ADA, and I head up the Health Policy Institute. We're going to talk about the latest data on the dental care rebound. Before jumping in, again, as we did last week, I think it's just important. I want to acknowledge, it's been a continued tough week in the U.S. We've seen the impacts of systemic racial injustices, and for those of us that work in healthcare, we know this is very, very vividly exposed in the recent COVID experience. Even in dentistry, we have racial inequality, and we've seen the effects of police brutality on that, and racial injustice is more than anything now also a public health issue. So as we get into solutions, just important thing to just acknowledge that. For those of us that work in healthcare, I think it's extremely pertinent. Let's dive in now to today's content. We want to talk about where we are in the dental care sector, how the rebound is going, and more importantly, where we see things progressing. So we're going to have a panel discussion. I'm going to bring the panel in maybe in the second, less than that, in maybe the second 2/3 of our discussion. I just put their pictures up here. You'll get to see them live in a few moments. But we had such a great response the first time we did this around. We want to invite the panel back with one great addition. So some of these are familiar faces. We have Steve Beuchaw joining us again, who's a director at Wolfe Research, researches a lot on life sciences. Ty Hamilton, who is at P&R Dental Strategies, lots of big data on dental insurance claims that she's going to share. We're welcoming a new panelist this time, Vijay Sikka. Vijay is the founder of Sikka Software. Again, really interesting sets of data that he's going to bring and perspective that he's bringing in. And we're pleased to welcome again Steve Thorne, who's the CEO and founder at Pacific Dental Services. As always, our wonderful HPI team, Adriana Menezes and Sylvia Zeno, they're in the background, but they'll be managing Q&A and helping out with the logistics of the webinar. So on the HPI side, before we get into our data, I thought it was just useful to share some recent research just on the economy in general in the US and how things are going. Just have a couple pictures that we pulled off of CNBC. This is interesting. This is simply on searches for driving directions, transit directions, walking directions. The point here is you're seeing what many of us had predicted and what the many economists predicted, this kind of sharp decline, but we are now seeing a bit of a rebound and kind of people slowly, let's say, getting back to normal things in life that they've been put off for 2 months. There's other data I'm going to show, the next one as well. Just some basic data on restaurant bookings. You see there in June, we're starting to see some rebound after basically a closure for the last couple months. And then finally, similarly, housing purchases, again, just basic indicators of life coming back to the economy in the US. And that's very pertinent for the discussion we're having because the dental sector is also in the midst of a pretty strong rebound. And so let's get into the HPI data. As of last week, which is the most recent wave of our data collection, hopefully you've been joining us. We've been collecting data every 2 weeks. We've had 48 states open as of last Monday. Not this week, but as of last week when we collected data. 48 states had reopened for elective care. You see those in green. And our data, as usual, we collect, again, from thousands of dental practices. If we go on, every 2 weeks, pretty healthy response rate. If you joined us last week, we had a specific webinar just on dentists working in public health settings. We went into detail there. But again, very, very healthy numbers, very representative sample. So let's get into kind of the key findings for the week of June 1st. Just a reminder, Q&A is the only way we're taking questions and comments. I see some of you raising your hands. Just go ahead and type your questions into the Q&A. and the team will help manage those. So the most recent data point is the bottom bar here, and we've been tracking whether dental practices are open, closed, and the latest data show that as of last week, 90% of dental practices in the US were open again for elective care. And about 1 out of 5, 20%, reported being back to self-identified business as usual. So again, we had a large shutdown in April. We've had consistent openings as states have progressed. We're now at a phase where 90% of practices have reopened. Next one, we look at patient volume and billings. So patient volume is the top chart. Total collections rates are at the bottom. Let's just focus on the top. During the shutdown or the postponement of elective care in dentistry, our data showed roughly patient volume was down to 7% of pre-COVID levels. If you look at the bottom bar in the top chart, as of last week, that had rebounded to 53%. So our insight is nationally patient volume reached 53% of pre-COVID levels the week of June 1st. And this is a steady week by week climb from the low point in April. Collections, similar upward trajectory. It lags a little bit. We think that's simply just the billing cycle. It also lagged a little bit on the way down. So we're pretty confident that's going to just catch up. Next thing we ask in our core survey is about, are you paying your staff? Here, the green bars indicate, yes, I'm paying my staff fully. The red bars indicate I'm not paying any of my staff at all. So again, if you followed the news this week, last week BLS data were released. There are several news stories. A great one, if you didn't catch it, in the New York Times by Sarah Cliff, who's a top-notch health policy reporter. But basically, dentistry is leading the certainly healthcare employment rebound, but it accounted for a significant share of total jobs added in the U.S. economy last month. Roughly 10% of jobs added in the U.S. economy came from dentistry. Point here is green bars are good. Practices are hiring back staff. They're slowly getting back to normal. 77% of practices have hired back their staff as of last week. So all these charts are showing a pretty steady, robust, sustained week-by-week rebound in the dental economy since states started relaxing restrictions on elective care. And we'll get into the panel discussion because when we first met, I don't know, roughly a month ago, maybe longer, we were projecting what things will look like. And I certainly projected a much slower recovery, but it's really sharp. And employment's bouncing back significantly, patient volume is bouncing back, and practices obviously have reopened. So a couple other things we focused on in our data collection last week, if we go on. One of the things, well, before that, this is from the BLS data, just an interesting comparison. So my team is, we track employment levels in dentistry, which is green, and comparing that to offices of physicians, which is red, and all healthcare, other healthcare practitioners in yellow. And here we're simply charting the percent of current employment relative to employment in January. So basically 100% means we're back to the same number of people working in these sectors as was in January. And you just see here the very exaggerated drop off in April in employment levels. Basically dentistry was down to 44% of pre-COVID employment levels. Much bigger drop than any of the different other parts of healthcare that we're charting there. But at the same time, a remarkable rebound in May. So according to these data, dentistry as a sector is back to 70% of pre-COVID employment levels. So we've clawed back a lot of the jobs that were lost in April. Not all of them, but a significant share. And our data in HPI confirm this. Very similar results from these two data sets. If we go on, Next thing we looked at in this week's survey was we focused on employee dentists as a separate group. This is an interesting theme we've shown. If you followed us the last couple webinars, employee dentists were not being hired back as fast as other dental team members. That's what the data showed. And here we are seeing that trend continues. So there is a little bit of a lag in how fast the dentists are being hired back, those that are employees, compared to like other dental team members. It's a slower rebound. But the good news is it is on an upward trajectory. So the top three data points, green is you're back to working. Red is I'm not paying my employee dentist at all. So we are seeing growth there. My point is the actual green bars are shorter than they were in those previous charts. And what that means is basically layoffs hit employee dentists hard. They're being hired back, but not as rapidly as other staff. So less than half of employee dentists are now being paid fully. And interesting, we have Steve Thorne who heads up a very large DSO. Maybe he can shed light on this if it's, you know, if it's true in his practice, if it's something we think is just lagging, or maybe there's something long term. We'll pick up on that. Let's go on to the next thing we asked about. Very important. We've been tracking the availability of PPE in practices. We think in HPI this is one of the most significant results we found last week. So here we're just showing the last 3 waves of our data, and we ask dental practices how much of each of those PPE supplies they have on hand. So red means I don't have any of those on hand, and green means I have at least 2 weeks supply. So as you go from top to bottom here, the red starts to disappear and we start to get a lot more green, particularly in N95s. So what this is showing here is PPE availability in dental practices continues to improve pretty dramatically in my view. So if you go to the top, the week of May 4th, almost a third of dental practices had no N95s on hand. And if you go to the bottom last week, about 8% had none on hand. And the green bars are growing rapidly. So this is great news. The ADA has been working tirelessly the past few weeks, working with FEMA directly, getting dentistry prioritized on the list for distribution of PPE. ADA stepped in and kind of helped with the supply chain as well. So it's great to see that in the data, the results are kind of there in terms of PPE stockpiles, excuse me, improving pretty dramatically. And if we go on, we have an interesting question we asked this week as a question of the week. We asked the 10% of practices that are closed, what do you intend to do in the next month and then in the next 6 months? And just focus on the top right here as a summary. I don't want to go into all the detail. But among the 10% of dental offices that are currently closed, 7 out of those 10 intend to reopen by the end of June. 2 out of those 10 intend to reopen within the next 6 months. And only 1 out of those 10 do not intend to reopen at all. So big picture, in our data as of now, only 1% of dental offices say they do not intend to reopen. And then that's a mixture of I'm going to retire, I'm going to sell, file for bankruptcy, other, a very small share say I'll affiliate with the DSO. But again, this to us, if you recall, early in the pandemic, we had a question about, frankly, financial sustainability and business solvency, where the data raised the concern that if things go very long, a significant share of dental practices won't be sustainable, and they'll basically go under. Number one, we're seeing, I think, a much faster rebound in patient volume, which is kind of making that point moot. We're not going to have the shutdown continue through end of June or end of August, as we had hypothetically asked dentists. But even still, a lot of people were thinking, well, maybe this will lead to a lot of early retirement, or people changing professions, or people simply not wanting to deal with the new protocols and the new hassles and frankly the new risk. But the new guidelines seem to be giving providers comfort, and for a variety of reasons, at least as of now, from my perspective, COVID has not been a dramatic shock to the solvency of dental practices. We have, again, about 1% that say that they're not going to reopen. And again, the bulk of that is retirement. So again, the deep contraction in April does not appear to be having a long-term impact on practice solvency. And again, at least for now, we don't know what happens. We don't know what happens if there's a second wave. And we don't know, again, as the panel will discuss, how far this rebound goes. Does it go to 100%? Does it stop at 70? That's going to be interesting. But at least for now, things are looking good in terms of the long-term sustainability of practices. Go on. The other thing we asked this week, again, looking forward, was this was our question of the week. We asked, how full is your appointment schedule this month? So for the month of June. And the dark green on the left is it's 100% full. And then the next one, it's at least 3/4 full. So just over a third of dentists said, yeah, my appointment schedule is 75% booked or more. And then if you include yellow, you get to basically our key insight here is the majority of dentists report their schedules for this month are at least half full. And a very important caveat, right? We feel we need to do more research on identifying, okay, is your schedule less than 100% full because you can't find patients to fill those slots? Or is it, that's basically the new normal. I can't see the patient load I saw before because of new anti-infection, new infection control protocols, additional cleaning I have to do. Maybe I'm at less capacity in terms of operatories, these types of things. So the panel, I want to ask them that is, do you think this is largely lack of patients wanting to come back, or is it just the new kind of phase of reopening? It doesn't go to 100% overnight. So keep that in mind as we finish up these slides here. That's going to be one thing I want to ask our panel. And then we also had a specific question related to kind of access for underserved populations, specifically the Medicaid insured. First, we asked within our sample, was your practice an enrolled Medicaid provider pre-COVID? And about a quarter of our respondents were Medicaid providers pre-COVID. That's slightly less than the national average. We know 38% of dentists nationwide are enrolled as Medicaid providers. And our sample is slightly less, but not that far off, frankly. But more importantly was the bottom question. We wanted to get a sense if there's a significant risk of providers dropping out just because of financial constraints or Medicaid programs, I don't know, potentially changing how they reimburse or things like this. So we asked the bottom question, looking ahead, does your practice plan to continue to be an enrolled Medicaid provider at the end of this month? And the vast majority, 3/4, said yes. The next one was not sure, and then a small share indicated they intend to drop out of the program. So we shared these data with the Medicaid folks in the government, as well as other stakeholders. Last week we went through them. Again, when I look at these, there doesn't seem to be an imminent kind of risk to the program of significant provider dropout. Now, obviously, it's important to look at, well, who are the ones that said, yes, I'll drop out? If it's those that simply dabble in Medicaid, that's obviously less of an impact than if those are practices that, frankly, are majority Medicaid. So a little bit more research to do there. Lastly, let's do a deep dive in the 27 states that we called early openers. So if you think back to May 4th, which is the first week of reopening, there were 27 states in green here that had opened for elective care. And what we're going to do now is I just want to show you charts only for these 27 states over time. So why is this important? This allows us to look at a fixed number of states that opened early, and now we're going to track, basically they're in week 5 at least week 5 of reopening. So again, a state that opened last week is going to look different than a state that opened 5 weeks ago. So let's look at the states that opened 5 weeks ago and see what their data shows specifically. And if the first thing, virtually all of the practices in these states are open. So by now, week 5 of reopening in these 27 states, 98% of dental offices have reopened. So this kind of telegraphs a little bit where the rest of the states may go. But honestly, things here are almost back to normal in a sense of open doors. And you look at the bottom green bar, right? 29% of these offices are saying, I'm back to normal. 5 weeks plus, and we're back to business as usual. I think that's quite a remarkable benchmark to hit, that almost 1 out of 3 and more than 1 out of 4 practices in these states by week 5 are kind of back to normal. So I think that's kind of very encouraging. Next slide. You look at patient volume here, just focus on the top chart here and the bottom bar. So if you look at the week of June 1st, last week, in these 27 states that have been open for 5+ weeks, patient volume is back to basically 2/3 of pre-COVID levels. So what this is, again, it's higher than if we look at 48 states overall, right? And that's to be expected. So basically, this is an even stronger rebound. And what we were looking for in this chart is, okay, by week 5, do we hit a plateau or not? Do we stop at some level? And at least by week 5, these data are telling us, no, we don't stall. We don't hit some ceiling. We're kind of keep rebounding. Now, obviously, the next week of data, we may have a different conclusion, and the week after that. But I think here it's important, patient volume continues to rise in these early opening states. So it's up to about 2/3 of pre-COVID levels. And again, same thing, similar if we go on, the next chart deals with employment. Here, again, you're just basically seeing exaggerated trends. Here, 90% of dental practices have hired back their staff. Earlier, I showed you nationally, it was 77%. So in these 27 states that have been going 5+ weeks, the recovery is basically more exaggerated and more sustained, frankly. So that's encouraging for the states that are just opening. This kind of telegraphs where things may be going. And if we go on from here, let's skip this one in the interest of time. Last thing I want to close on is insights from consumer polling. So we showed these 2 charts last webinar. And these are 2 polls of the public. So these are not HPI data anymore. But what they're showing is visits to the dentist actually rank pretty high in terms of things households want to get back to doing. Particularly if you look over a time horizon of like 12 months, which the survey on the right does from Fleischman Hillard. It basically has going to the dentist as the top thing in healthcare. So on the right, it only asks about healthcare services. It's the top healthcare routine / service people seem to want to get back to. So that's really encouraging. The next slide shows a new poll that came out that we haven't showed before, but I think it's really insightful. It's from Kaiser Family Foundation. And this one is interesting because it puts healthcare in the context of a bunch of other things, like going to a concert or going to a restaurant or flying on a plane. Going to a dental or medical appointment is number 1 here. So in terms of what the public seems comfortable doing or willing to do, frankly, my take on the data is all these polls are showing pretty convincingly that going back to the dentist ranks really high. So there does not seem to be some, let's say, significant safety concerns. Obviously, this is averages we're showing here, right? So if you look at Republican men versus Democratic women, etc., you get some different results. But by and large, on average, My take is there isn't some new inherent safety hesitancy or safety concern. So whatever we've been doing, or others have been doing, it's not HPI, but CDC and the ADA and the science folks about getting the guidelines out, getting new protocols, getting toolkits in the hands of dentists about reopening, helping secure PPE so that dentists have the necessary supplies they need to adhere to the new infection control protocols. All that seems to be working in terms of, I would say, giving the public comfort. Now, what these data don't go into is things like, well, if I've lost my job and I've lost my health coverage and I've lost my dental insurance, is there some economic factors that may limit me to go back to the dentist? So that's stuff we're going to explore going on. But look, at least for now, and we've been tracking these polls for several weeks, to me, the data on the public are very, very kind of encouraging. And I know Steve B has some data he's also been collecting on this. So I think we'll stop there. Sylvia, I believe there's a summary slide. I'm not going to read all this. This will be in the PowerPoint that we put online. But just go to the bottom one for just sake of brevity. Taken together, our data and the data we've scanned from the public polling continue to indicate a robust recovery for now in the dental economy. Certainly way faster than what HBI had predicted 6 weeks ago or 8 weeks ago. So let's move on now. That's kind of the data, the data overview from HPI. I want to hand it over to Steve Thorne now to walk us through some of the analysis out of Pacific Dental Services. And just a reminder, the webinar will be recorded, slides will be available, and keep your questions coming in through the Q&A box. So Steve, take it away.
Hey, thanks for having me, Marko. Great to be back. Love getting your data. I can give a little bit more color from a large DSO perspective. As you can see here, we had this is just a good graphic of how steep the decline was and now what we're back to. And actually yesterday, had to give you this slide yesterday, but I have yesterday's data now, and yesterday was even better than the 9th. So yesterday we actually got back to 96% of where we were. Maybe by the end of the week or next week, we'll be back to 100%. So your data is exactly right. I was wrong. I thought it would be a much slower improvement, but it's been a nice, quick improvement. I think to answer your question, you had a question about volume. So our docs are now seeing the exact same volume of patients per day, which is shocking to me too. They're averaging 10.8 patients per day. That's where they were pre-COVID. So that's a GP dentist, by the way, which is really interesting. The area that's been tough, and I think it's been tough for most large groups, is in the hygiene area. I think it's a combination, a little nervous on the safety, right, rightly so, but also I think a little bit on the benefit side. There, on the unemployment side, the spread between what they make and what they can make staying home, it's been harder to get the hygienists to come back. So we're back to 80% of GP days. But hygiene days, we're still back only we're down about 50%. This is really interesting, I think. Call volume this week has now exceeded pre-COVID. So the way I'd explain it is we have approximately 825 practices around the country, millions of patients that want to come in. In the first few weeks, a lot of new patients and kind of pent-up demand or urgent care came back. But what we're seeing right now in these last few days is more normal routine care, what we call continuing care patients wanting to come back in and get their care. So it jives perfectly with the data you're showing. And I think that's the spike in volume right now. So where we're struggling now is to open enough space to get those patients in. The demand is actually exceeding our ability to provide the services. So it's very promising right now. What we don't know, and I'm very optimistic, but what we don't know is what this will look like in 3 or 4 or 5 months from now. We don't know if it's that pent-up demand, but I'm optimistic right now.
Thanks, Steve. Very good. And I remember, and I stole your phrase, the elevator ride down and escalator ride up. And,
yeah, I noticed that.
And
you didn't
yeah.
give me credit either. Yeah. Come on, man.
But before going to Ty, while I have you, can you comment on the potential lag in employee dentists being hired back? Is there a potential long-term effect of like, I don't know, owner dentists not really needing an employee / associate?
So it's really interesting. I just got on a call. So, from a purely business standpoint, the owner dentists, their productivity is up. Patients are actually staying. I think it's a combo. Patients are staying and getting more of the care they need per visit because of the risk and all the factors we all know. And dentists are getting better, it appears, at doing more of the dentistry that patients need per visit. So that translates to a little bit higher productivity for the dentist. So it causes them not to maybe bring back the employee dentist as quick. I think we're seeing that's real. We're seeing some of that.
Okay.
So does that answer your question?
It does. It provides some reasoning on why we're seeing the trends we're seeing in our data. So it makes sense. Very good.
And it's by market. There's some markets that we're struggling to get the dentist back because it's so competitive, and it goes along with your slides.
Okay, very good. Okay, great. Ty, the great thing about your data is well, among other things, it lets us look at like the procedure mix. So Steve was alluding to, well, is hygiene recovering as fast as, let's say, restorative work? Or are we really dealing with a lot of pent-up issues versus routine appointments? I know I just rescheduled my routine cleaning for like next week, right? So go ahead and shed light on that. And I know Vijay has some data on that too. But let me hand it over to you, Ty.
Very interesting so far. And I think that what we'll find as we move into this, looking at from the insurance claims side of this, drawing on the cross-payer multi database that we have, that what you see at the top there is, Marko, similar to the graph that you put up. The left side of the graph is showing you kind of pre-COVID. So that dotted red line is baseline. I think we're seeing a lot of graphs that look exactly the same way when we get to the last 2 weeks of March. There's a deep crash, almost instantaneously going to 50% at a certain point at the end of March, and then dropping down into single digits, and then just kind of sitting there. When you see that turn up at 10.2% at the week ending May 3rd, that's your first week of the 5 weeks of recovery that you were just describing. And it has gone up nationally week over week over week. And that's a rolling reopening of offices. So there were a chunk that came in that first week that are contributing as they're gaining momentum. Simultaneously each week, additional states are reopening. And so at the week ending May 31st, you're at almost 60% of pre-COVID volume nationwide. So these are national that we're looking at. And week ending June 7th is incomplete. I mean, that would be last week. So we're looking at just a partial reporting of the volume, and you're already at 75% nationally of the pre-COVID volume. So I think this line that we're looking at is very consistent with what you show, Steve. I think it looks a lot like your graph as well. And so it's showing across other data sources and nationally across every state. So let's take a look at the next slide, because that becomes kind of the topic of conversation here in terms of what are the geographic differences on this. So you're at a week and some days for some of the states in the United States at this point. And New Jersey and New York are kind of standouts on this graph that we're looking at. So just to level set you really quickly, the graph across the top is a little bit busy, but each bar is the nation and one of these 5 states that we're looking at. So you'll see that yellow and orange are Arizona and Texas. So kind of even throughout the complete flat period across April, yellow and orange are higher than the rest of the states that we're looking at and the national average. So that's an example of where, while everything dropped everywhere, kind of similarly, it didn't drop as much in some states. And so it didn't have as far to go to get to material 75, 80% recoveries on the other side of it. So Arizona, as of the end of May, was already at above 80% of pre-COVID levels across the entire state. Texas, greater than 80%. Whereas California, a little bit more gradual. That's the blue aqua color that you see there, but certainly showing the same kind of exponential kind of rebound. And then you see New Jersey and New York, which are on the later side of the opening, staying really, really, really tight and not seeing nearly as much change. But New York is at almost 30% as of this last week, which is a material increase in what is a very short period of time. So next slide. So this one right here is the one where kind of getting the insight around whether or not it's really just pent-up demand. Is this a lot of urgent emergency that was progressively getting worse over time, and finally the doors opened and they all ran back? So just level set you on colors. Green and orange are what are either highly likely or most probably emergency and urgent services. On the other end of the spectrum, blue is wellness care. I mean, we're talking about things that are non-essential services, routine care, preventive care, regular diagnostics. In the pre-COVID world and in a normal world, better than 60 to 70% of the care is in fact in that non-essential blue color. And so from here, we can just kind of take a color look, kind of using your same thing. Blue is non-essential, green and orange are urgent emergency. So urgent emergency were the smallest portion of care pre-COVID. And you see that in April, huge shift. Green and orange, you know, just by virtue of what was going on with offices, are now the dominant. And it's a little different from one state to the next, but it's not that different from one state to the next. Blue is much smaller, and green and orange are much bigger. So now, next slide, please. So now let's look at May. Right away, you can see as soon as you flash at that screen that you are back at distribution proportion of blue that is near normal in many of the states that we're looking at there. So you see across the U.S., you're at 65% non-essential services in terms of literally what is the distribution of the treatments that we're looking at. And it varies by state based on recovery, and in terms of New Jersey and New York definitely being the most restrictive, but you can see even from this one that there's more blue in those states as well. So you still have a higher than usual pre-COVID orange and green distribution there, but it is very quickly actually starting to look really like exactly the same distribution graph that occurred before March.
That's really great, Ty. That's exactly, these data are very rich. So there's our answer, right? And I'm looking bottom right at Texas, right? And that's one of the I guess on the leading edge of reopening. And I look at that and that looks just like it looked pre-COVID, right? So thanks, Ty. Wonderful.
Thank
Vijay,
you.
welcome. Nice to have you on our panel. Why don't you walk us through kind of what your data are showing?
So, Marko, it's a pleasure to be here. just a very quick 2 seconds, if I may,
Of
take
course.
just to introduce how we get the data and why is it interesting. So, my background is AI and neuroscience, and I'm a data plumber, a software geek, and a DTS. That's dedicated dental spouse. My wife is a dentist. And so the company, Sikka Software, has a platform that is compatible with all major practice management systems and provides data and insights, through both dental and ortho and specialist practices to identify success and improvement opportunities. And we have about 28,000 dental installations, about 120 million patients on our platform, and adding a healthy number of new practices a day. The data that I'm going to share with you is from about 11,000 opt-in practices, and it is empirical data coming directly from practices and includes both providers and payers data. And so this is the first graph that I wanted to share with you. When COVID hit, our customers saw an 85% drop in their daily production and patient visits as a result of the shelter-in-place orders, and that you have seen in similar graphs shared earlier today. And so from our perspective, we jumped into action and we said, okay, well, we have this data. Why shouldn't we bring that and make it available to the dental community? So we created this website, which is accessible right from our homepage, and it shows this COVID impact. So this graph is from that page. And the dental industry, one of the key things that I wanted to highlight for you here is the dental industry rebound is well underway. I mean, you heard from Marko earlier that 90% of practices are now open and starting to do routine care. So the things that I wanted to share here is that we see a 4-week average of 21% increase in production nationwide. And the slight dip that you see in week ending May 31st is as a result of the Memorial Day weekend. So go to the next slide, please. So this is a tale of 3 states. I just wanted to share these 3 states. Of course, you can see all states on our website, and you can see each one of them in detail. But I wanted to share with you these 3 states because these are interesting. If you look at, first of all 3 states suffered the drop that we discussed earlier. And Texas opened 2 to 3 weeks earlier and saw an increase. And that's what you see here in the purple line. And California opened up 2 weeks ago and saw an immediate increase, as you can see that in the aqua or blue colored line. And then New York is open 1 week and is following the same trend. Now, I want to share with you that this data is as of this week. So this is empirical data coming as of this week from the practices that I mentioned earlier. And go to the next slide. And so this is one of the things that we started to do was we said, if we can actually see the lessons that we are learning from all the practices that are open and all the states that we have data for. And as Marko, you highlighted, over 20 practices open in May. How can we predict when New York will likely match the average? And it turns out that New York will likely match the average on week of July 11th, based on where we are. So this is using predictive models. The red is the upper confidence, the yellow is the lower confidence, and the green is where we forecast New York will hit average volumes based on pre-COVID levels. And so related to this, I wanted to share with you is California will see that on June 13th, based on what we are forecasting. Now correlate that with Steve Thorne's comment of reaching patient volume at the end of this week. But that's a direct correlation because you can see that these are independent data sources coming from 2 separate companies, and we can tell you with high confidence exactly when different states will reach pre-COVID levels. So that's a little bit on predictive modeling. Let me just make one quick comment before we disengage. You mentioned, Marko, that procedures and functional areas of practice. So we are also seeing some interesting things, and they are also available on our website. We are seeing restorative procedures, fillings. They're almost at 19% of pre-COVID levels. And this includes all the states closed and open. we are seeing preventive, which is hygiene, is within 6% of pre-COVID levels. So patients are coming back, and hygienists who do regular teeth cleaning and periodontal treatment are starting to do that. Sometimes dentists are doing that work. And it shows that pipeline of dental procedures is definitely starting to fill up. And consumer confidence is high. And then the second thing I wanted to share with you is that the ortho and implants and oral surgery, they are close to pre-COVID levels. They actually saw a little bit of a surge, but they are back down to pre-COVID levels, which is also a good thing. Initially, we saw a backlog of people who had to get those procedures done due to emergencies, but then that backlog seems to be starting to get over. So that's a decent indicator that things are gradually going back to normal.
Okay, very good.
Yeah. Thanks again, Mark.
Good. And I like the fact that you brought in some predictive analytics as well. That's fantastic. Let's see if we can get Steve B's slides up. Steve Beuchaw.
Sure, I'm happy to do that. I'll give just a touch of background, and then we'll go there. When we were on the panel a few weeks ago, we introduced a couple of data tools and surveys that we developed specifically for the COVID environment. Back, if I think about early April, when I was hearing from so many people that there would be this dramatic pullback and things would remain depressed for a long time, my feeling was that the primary question to be addressed was really about consumer attitudes or patient attitudes regarding safety. And so that's where we really concentrated our effort. We launched a new consumer survey, and we have e-commerce tracking engines that we've used historically, but we really tricked out to be higher frequency and to some extent region specific. And what those were telling us several weeks ago was that there was an intention in the event that practices open up for people to go, oh, there's my slide, or one of my slides, to go back to a dentist given the opportunity. Thanks for this. So if you look at the grid on the top, what it's showing for the May 2020 survey and the April 2020 survey, in the first column in either case is, how many times did people in these states go to the dentist? And we asked the most basic question, and we have, in both cases, between 130 and 150 people answering. And it's between, 1.5 and 2 times for the full year. And we ask them, okay, well, this year, we know that this is a very new environment, and there's certainly risks and things you have to consider that you didn't have to consider last year. But people told us very consistently that on a full year basis, they intend to go back to the dentist, and they intend to go to the dentist on average as many times as they did last year. When I initially saw the data, I thought that just doesn't make any sense. I must have done something very, very wrong with the survey. But fortunately, we have a cut of the data that looks at a next 90 days number. And you can see in both the May block and the April block that there's an anticipated reduction for, let's call it the April to July period of between 30 and 50%. So a pretty dramatic, very consistent with the data that other folks on the webinar here are saying, pullback in terms of the number of visits. I would argue actually that some of the data that I've seen from the panelists here today in terms of how fast things have come back are actually a little surprising to me in terms of how strong they are. And that's coming from the guy who was the big optimist several weeks ago. So really even stronger than I would have expected. If we look at the next slide, we've looked at how at a higher level, some of the trends compare in the US in between dental visits and orthodontist visits. Probably not surprisingly, we've seen a lot higher interest in going back for orthodontic care. And we've seen some interesting variation in other parts of the world. For example, in Japan, where you had a pullback and then they had an upwelling of the virus. And so things have pulled back once again there. Or in Germany, where things were really roaring back, and then you had your ups and downs. In Germany, where they've controlled the virus very, very well because of a very different testing strategy, it's probably back to within 5% of normal at a national level. But I'm gonna reverse my role this time relative to what my role was last time when I was the optimist on a webcast full of people who were concerned. If you go to the next slide, as I cut the data at a a state-based level, and I look at how consumer attitudes are trending, to be honest, I'm a little worried. I'm worried because I think, and Vijay alluded to this a little bit, that what we might have seen here in the last few weeks was a fair amount of pent-up demand. And I think over the next 30 days, we're going to have a lot to learn in terms of figuring out what, in a COVID era, the norm is. I was really, really happy to hear Steve Thorne talk about the ability to treat a very large number of people. That's been a concern of mine. But I think that the rebound that we've seen probably is, if you look at states that were early openers like Georgia or Florida or Texas, there probably was a significant amount of pent-up demand there that we are working through. And so I hope that expectations are probably not for things to be back to normal, whatever normal is, for a while, until we get a higher degree of comfort on the clinical side with how we do or do not transmit the virus. So that's it for me. Happy to talk about this.
If I can just clarify what you have on this screen, right? Are you saying, like, if I look at Georgia as an early opener state, is your concern rooted in the fact that the Georgia curve seemed to be flat the last few weeks there, and they're not continuing to rise? Is that what you're getting at?
Well, a couple of things. Well, maybe let me explain what this is. This is a hybrid of web search and social media activity. What I've found is that it's an indicator of consumer sentiment that tends to give me a week or two lead in terms of what's going on out there, because it takes a little time to schedule a visit, right? And we, even a week and a half ago, were seeing in some areas, you flagged Georgia, certainly a very good example, some areas where people were actually starting to pull back, which I did not expect, frankly. I thought we would be on this trajectory back to flattish, which in retrospect, I guess was a little too optimistic, because it still is, the reality that people are thinking about dentistry with a higher degree of trepidation for reasons we all know. So yeah, it seems like we are starting to see just a touch of a pullback, more so in dentistry than in orthodontics. And I very intentionally superimpose those two relative to each other, because the aerosolization dynamics in dentistry and orthodontics are, of course, very different.
Okay, very, very good, Steve. So let me pull back here and let's get the panel together. That ends kind of the picture show. First, on my behalf and my teams, thank you all for coming and sharing. Like, we're all about data-driven insights, and you each bring a really unique data set that's very powerful. And so one thing I really enjoyed was seeing how, like, okay, do our conclusions align every time, or do we have some areas where maybe they don't? By and large, we're kind of in the same zone of a pretty big rebound now. Are we at 60% pre-COVID, 75? I heard from Ty. I heard Steve, something 96, something versus 80, whatever. Those are high numbers. Steve Beuchaw also had that similar shape of a curve. We all seem to be kind of showing the same pattern of recovery. Adriana, keep collating those questions, but I'm going to just ask the panel myself. Let's get right into the future here. So where does this end? Steve, you just gave your thoughts, but let me bring in maybe Steve Thorne and maybe Vijay and then Ty too. Where do you see this going? Because the core thing, like we've been thinking about, is can you even get back to 100%? Let's say if all the patients came back, is that reasonable given the new protocols and the new productivity? And if it's true that you can't hire back all your hygienists, is there potentially a shortage of staff? I don't know, Steve, let me turn it to you, then Vijay, then Ty, because Steve B just spoke, Steve Thorne.
Yeah, and I've got to jump in a couple
where
minutes,
do you think we'll land? And give me some numbers. If I look at the next, let's say 6 months, do you think we're back to 90%? Do you think we're back to 95?
So we are seeing, and it's a very short time period, Marko, and I really appreciate what you said, Steve B. We're seeing a near-term increase in demand from existing patients wanting to get in.
Existing patients.
Existing patients pre-COVID. So we're seeing that finally pop. That wasn't the case up until last week. If we had this conversation last week, that would have been a different conversation. Now, what we don't know is it sustainable through the end of the year? To back what Steve B is saying, I'm cautiously optimistic that it is, based on call volume, based on all my data. Yet, I'm nervous because there's still 40 million people unemployed. I'm nervous about what we're seeing just in the last couple of days in Arizona and Texas and Florida in kind of the rise of the COVID again. We're coaching our teams to be hyper cautious, hyper safe, because I think there is a little bit of overconfidence right now out in the marketplace because of the demand that came back so fast. So I'm cautiously optimistic. I'm with Steve, a bit nervous, but our data is showing if we can stay focused, that yes, we will be back above 100% much sooner than we thought, and it will be in this year.
Okay.
So that's what we're guessing.
Yeah. Go ahead, Steve.
I'll have one in.
Yeah, go ahead, Steve.
Steve Thorne, how much do you think your operation is benefiting from being really front-footed, available, and communicative, while other practices might not have been as available in terms of outreach and availability for patients?
I mean, we were able to, our docs, most of our docs stayed open right through the whole process. We talked about that last time. Roughly 700 practices stayed open. So I think it's a massive benefit. Availability was there. And but I do know, I was on our ADSO call. Others have experienced the similar increases. In fact, others that have brought people back are actually exceeding our expectations and our numbers. And I did talk to a couple DSOs that are already above 100%, Marko. So,
wow.
Yeah.
And Steve B, our data, I didn't show it, but our data, when we slice it by DSO versus, let's say, solo practices, there are differences, right? The DSOs are, in my view, are on the leading edge, right? So they're showing larger rebounds than the solo dentists. Vijay, very quickly, anything to add?
Yeah. So
give me a number. Where are we?
Marko, I'll give you the numbers that we see. So just to give you an idea, we see North Dakota, Wisconsin, Kansas, Wyoming, Utah, South Dakota, Tennessee, Florida, Hawaii, Arizona, and several other states at or above COVID levels.
Okay, pre-COVID.
And the reason I say this is because there is, yes, definitely a pent-up demand, but we also see another industry, which is veterinary, which is 15% higher than, for example, pre-COVID. So there are some fundamental changes that are happening overall in the industry across all of these industries. And it is true that, some DSOs which stayed open, as Steve pointed out, are seeing the benefit. We have some detailed DSO numbers. Overall, as an industry, actually, we see that solo practitioners are doing better than DSOs as it comes to bounce back, just as based on our empirical data observations.
Okay. And Ty, any either formal modeling you folks have done or just your insights? Where do you think we are in 6 months?
I think consistently with 6 months is too far out for us, certainly, to make some projection based on historical trend at this particular point. But we will be looking at that very closely because we do projections. And if you'll recall, at the last presentation, we kind of talked through if it stayed where it was for the duration of the quarter, we projected what it would look like. Obviously, that didn't happen. And so we're working on now, as we look at Q3 performance, what do we think? And it'll be probably a mix of stuff. And so we can definitely see in the data that it's indisputable that the mixes are non-essential and it isn't being driven solely by pent-up urgent emergency demand. I mean, that's clear. But to Steve B's point, how much of that is early adopters and just the pure need for normalcy? I really want to get back to my normal routine, and that means going for my regular scheduled visit. And So Texas, Arizona, I'm from Texas. And I can tell you that in Texas, we didn't see some of the extreme implication of infections like you saw in other places. And so maybe didn't hesitate as much to jump right back in there and start doing our thing. And if that changes, I suspect that it will, in fact, actually change behavior. And that is pure my thought, but we'll be looking at subtle changes that we can see in data upturns. We're watching it geographically because I think we've moved away from kind of what is the national take, a second wave, more stuff driving it. So thank you.
Good. We'll get back to the second wave. Certainly from my perspective and my team, I mean, I don't know. I can't see how 100% is feasible. I mean, simply because of the employment numbers, right? I mean, with 40 million, and even if those jobs are primarily in sectors that don't provide comprehensive dental insurance, right? There's still, we know from history, there's still a knock-on effect from employment. Now, how big that is, I think, is what we should debate. But that's where I think like the 100% number to get back is to me not feasible. But I don't know. Steve B, very quickly.
Hey, Marko, we actually asked people about that in our consumer work. I didn't put it in my slides just because I was trying to be quick, but
sure.
We asked people either as a function of the economy or your job status, do you perceive dental care to be more expensive or unattainable? And the answer was a resounding no. Really no impact, no net impact. Remember, as a function of a lot of this is not dentistry specific, but a lot of healthcare policy changes, there are a lot of people who are actually gaining dental coverage because they're going into Medicaid. So there are people who are on ACA plans that are going into Medicaid. There are people that might have been on employer plans that are losing coverage. Those two largely wash each other out. There's really not a net impact.
I get where you're going, yeah. If they're in a state that has an adult benefit, right? That's a big caveat because it's not universally covered like it is for kids. But good point. It might be a wash. And again, it depends what sectors are losing jobs, right?
Yep.
I would think, restaurant industry versus airline industry going to be very different in terms of what health plans you have, right?
Yep.
But anyway, I think that's something we can follow. Let me bring Adriana in. Let's see what's going on in terms of our audience Q&A. Why don't you kind of share some of the common themes, and you've had the challenge of collating questions, but why don't you kick us off?
Hi, hello everyone. It was fun to use my skills of categorizing comments. We've received dozens of comments. So the common things we're talking about dentists being back and volumes being back to close to normal levels. But what is normal? That's one question that I'm getting. So I can read a couple ones from Corey here. Do you think that these patient volumes are a result of a surge of past due care, which will flatten out over the next month, and then we'll see typical summertime trends in terms of volumes? And I understand that some of these have already been addressed. I'll just pick another one under that theme. Is the practice appointment schedule containing the same number of slots or a reduced number of pre-COVID appointments? Or what is the panel sentiment as to whether the volumes observed thus far are a function of pent-up demand that will subside over the coming weeks versus a return to normal? How does the procedure mix compare versus pre-COVID? And there are tons more under this theme, so I apologize if I didn't read your question. But would anyone like to address these?
Yeah, why don't you start, Ty? So we've talked a little bit about those, so I think we can just give us a summary, Ty.
From my perspective, Marko, I thought that we already covered many of those things. I just wanted to actually acknowledge the seasonality. What is normal? Right now we're measuring to pre-COVID levels, but there are natural depressions that occur. And so if you really got back to normal, meaning truly normal, July wouldn't look like April. It would be much lower. And so as we move into kind of looking at this next level, we'll be doing some adjustments for year-over-year seasonality so that we're not just measuring how low have we dropped since Q1, but what do we think normal looks like. Now, 20% drop from Q1 to Q3 is not normal. That's a much deeper drop than what you would expect to see in normal seasonality. But how different is it going to be? It should really be about 6 or 8% lower in July, year over year, just kind of on a rolling seasonality, because folks aren't motivated to go to the dentist. They're, got competing interests. But you would see that surge back up in August and September as back to school starts. So there's a little bit of a rolling seasonality component that I think will add dimensions to this as we start looking at what is normal.
Okay, very good. And I know our data to ask about what is your volume this week compared to what is typical. So we leave it to the provider to say, oh, okay, January or July is going to be different than what is typical. Vijay, very quickly, just something to add.
No, really quick. Marko, there was a very interesting slide and data that we were looking at where we compared 2020 COVID recession or lockdown recession with 2008, the Great Recession, right, the financial crisis. We found that the financial crisis was nowhere similar to, that 2008 crisis was nowhere similar to what we have seen here, where we all know that the production dropped 80% and the rebound has happened with a very tight U. But the interesting thing I wanted to observe is that other than the seasonal variations that Ty mentioned and the drop downs in production that we see during the typical holidays like the Memorial Day and all those and Christmas holidays, one of the other things that we saw back from the data from 2008 was that 2008 to 2009 growth was not there. So one of the things that could potentially happen, even if we get back into 2020 pre-COVID levels, we might see that it will not grow as much as it would have normally grown. Just to give you an idea, dental production compared to 2008 has now reached 40% higher than what it was in 2008 in 2020. So that shows that dental industry is growing from a revenue production perspective also. That growth, incremental growth, which is expected from 2019 to 2020 and then to 2021 will probably not be there.
Okay, before I get back to Adriana, Steve B., you look at a lot of financial data, right? And one thing I've been thinking about, and I think there are probably some comments on this too in the Q&A, so we talked a lot about volume and visits, but what about profitability? So presumably the extra PPE costs have to be borne somewhere, either through profits or passed on to patients directly, or insurers make up the gap, the payers, right? I don't know where we stand on that. At the same time, Steve Thorne, before he left, was telling us about, well, productivity hasn't taken a hit. Then dentists have gotten used to now doing more during one visit, et cetera, et cetera. Any insights on profitability of the sector in general, or is all this kind of a wash?
I can try to piece something together. So my feeling is that for practices that reopen, they reopen with, let's say we were in a pre-COVID world. They probably were operating between like 50 and 70% of theoretical capacity.
Okay.
And so to scale up the number of hours, days, shifts, you can actually, even while maintaining an appropriately incrementally safe work environment, probably maintain your volume. So I would imagine Steve Thorne's operation is sort of on the cutting edge in terms of really making the changes to get there. I think most practices will get there. So in a hypothetical where we say people come back, but I'm agreeing with the sentiment on this panel, which is it's not going to be 100% for a while. If people were to fully come back, then that would really get you to revenue that's pretty close to normal. There are incrementally some payer policies that I'm hearing about from DSOs around the country where they're starting to increase reimbursements to account for the PPE cost.
Okay.
I think that's very, very early, and I don't expect it'll necessarily be the norm. And I'm already hearing from patients some frustration as they're being asked to pay an incremental, let's call it $20 a visit. And that's creating real frustration. I think at the margin, I mean, it'll be small, but I think at the margin, it will be a barrier to visit volume. But the amount that a visit costs a provider probably goes up by order of magnitude $15 or $20. And so there is, even if we get back to full volumes, going to be a pretty significant drag on practice profitability. And I suspect that people have figured that out. That's why if I look back at some of your slides, Marko, which were great, by the way, there are a lot of people who are saying, look, one way or another, I counted it up to be like 20, 25%. We're either going to sell the practice or we're going to collaborate with a DSO, or we're just going to make a big change of some sort. I think the economics are going to be a lot harder.
And it's interesting, Ty, I want to bring you in on this question of, do you have any insights on productivity? Like, let's say procedures billed per, but before that, Steve, I really like your point about if we were pre-COVID at less than efficiency, right? You're basically hinting at there's slack in the system, yeah? And now if this crisis pushes you to like the Pareto frontier, as economists would say, or towards efficiency, that's a really interesting point. And Steve Thorne alluded to that by saying, oh, they're trying to do more in one visit to keep the patient from coming back, right? Okay. Ty, anything on productivity?
Yeah, so on that particular topic, Marko, what I was thinking about was what is normal? And that actually isn't a universal answer for every single independent practice. So you have doctors that don't, in an independent practice, who really aren't looking at 10.8 patients per day as their normal. And so when they tell you that they're back to normal, they may be back to normal at part-time or half that capacity.
Right.
And so as we start looking at this, we're really going to try and want to get our arms around, and it's something that PNR will be evaluating, is, to your point, average patients, average procedures. Is there a change? Are they lower cost or higher cost, longer treatment procedures, so that we can get our arms around what is normal?
Well, the good news is we all have data, so we'll be tracking that. Vijay, I want to give it back to Adriana, but hold your thought. You can bring it into the next one. Adriana, back to you.
And so there are a lot of questions on PPE and reimbursement and cost. I'm not sure. I know we've just covered some of this, but I'll just read a couple of the questions to see if anybody has something to add. What can we do to urge Medicaid to help with PPE? Commercial plans are increasingly covering. Are there not patients who are equally grateful for the additional PPE for protection of their healthcare? How long is expected for higher PPE costs to continue? Who will foot the bill? And related questions.
I think we covered that. I would just add on the Medicaid side, a lot of advocacy groups, including the ADA, have really been working the past few weeks trying to get Medicaid to kind of, especially for the Medicaid providers, basically, right? To have some financial package equivalent to what's been done on the PPP program or the EIDL for the private sector, right? So I know recently this week, HHS announced some relief efforts for Medicaid providers. I don't know if notionally that is meant to be like not just income supplements, but also to cover your additional PPE cost. I don't know, but I don't think we have an answer to that one, but it's on the radar. So I say move on. We've covered the PPE angle, I think, pretty extensively. There was something also about a second wave that a lot of people were asking, right? Were you going to jump in? Okay.
Yeah, that's exactly where I'm going to. So lots of second wave concerns, and I'll read a few. So Bruce says just what are the concerns about second wave? Richard said, what kind of impact to dentistry if we have a second surge of the COVID pandemic? Will this be as bad as the first one? Also, John says CDC is stating that we're seeing an increase in COVID cases again in some states. How do you see the impact this may have on patients' confidence in going back to the dentist? There are a few more, but
okay,
I think
but that captures it. Thank you. So that's interesting. So let's get to the second wave. So potentially, let's say we do have increased cases, and let's say the curve starts growing again in the fall. I don't know, from my perspective, the first question is, how does dentistry react? Like, what does CDC and ADA say about, will we do the same thing we did in April or in March with the recommendations to delay elective care? I don't know. I'm not a clinician, I'm not a scientist, but I think that is the key thing. And maybe we're now in a situation where, we have the protocols in place, right? The new guidelines are there. And maybe we don't need to go through the same kind of delaying elective procedures. The only thing I think we haven't talked about is I think it was a very strong signal to the public to say this is not essential care, right? I certainly know anecdotally a lot of the public is like, what? What do you mean the dentist is closed? This is very important, right? So I think that's another thing that comes into it. So I don't know. Let me go around the table. Let's say this happens again in September. Do you think ADA and CDC will go down this road, or do you think now we have the PPE on stock, we have the protocols, we don't need to kind of shut down? Can I ask Vijay? You start with this one.
So I will, because I have an anecdotal.
Or just tell me what you would like or what you think should happen.
From my perspective, most dental practices which are opening are taking appropriate PPE, negative pressure rooms, basically extraoral suctions, and doing all kinds of things which help them reduce the aerosolized nature of the treatments that they are performing. And this is based on conversations that we are having with our dental customers, and also, what my wife's practice is starting to do, right? So I feel that dental practices today are more prepared than ever to address some of the concerns around infection control. And so with that, now we don't know what the political as well as policy bodies will say, but we are also seeing some wariness amongst the economic leaders saying that why should we close down again?
Mm-hmm, mm-hmm.
So there is this, in my opinion, unless, of course, looking at the history, the 1918, the flu, the pandemic, the second wave was actually worse than the first wave. And so if something like that happens, and if things really go catastrophically bad, then we don't know. We think that same thing could be repeated. But right now, our assumption is that it will continue with the appropriate safeguards that are in place.
Okay, very good. Yeah, anything to add, Ty?
I would just add that I think that it'll be very geographically specific, but albeit more measured than perhaps the initial response.
Any insights to add, Steve?
It's hard not to use this as an opportunity to deliver something of a PSA. By far, the biggest driver, by at least a full order of magnitude, the most important variable to consider in answering this question is, how often do people wear masks? This is not a question about dentistry. This is a question about epidemiology. If the virus spikes, people will get worried. People are certainly aware of aerosolization concerns. If people wear masks, we are good. If people don't wear masks, then we have a problem. I would agree with the sentiment that practices are certainly much better prepared. Negative pressure, which sounded like a really difficult thing to deliver maybe 6 months ago. Now you realize you can do it. There's a company in Houston that has some pretty clever, not wildly technical solutions for that, and so you can get that done. But this is really an epidemiological question. So I'd say we should just be focused on being good actors, good people. Wear our masks when we're not inside on a Zoom chat, and we'll be okay.
Okay, good. Adriana?
A topic that I don't believe was directly addressed yet is on infections in the dental office. So Bruce asked, is a track and trace program in place in any state that could implicate in more or hopefully exclude dental practices as a source of new clusters of COVID? Are we collecting any data on provider COVID infections? That's a question by Philip. Monica also asked, are there any COVID increases in infection in dental settings in early open dental offices?
So from HPI, and we're collaborating with our science team on this, we don't know of any confirmed cases of transmission via dental office. That's not to say there aren't any, but as far as I know, the CDC also last week said the same thing on their webinar. The ADA is pursuing a study to look at infection rates among dentists. It's not going to go into the detail of tracing like the question is asking in terms of very detailed contact tracing. But we are on it in the ADA, our science group, and HPI is leading this, collaborating to look at this. But I mean, those data aren't going to be ready for a little while. But does anybody else have things to add? Do you know of any data being collected on transmissions via dental offices? Okay, no, Steve, no. Okay. Back to you, Adriana.
Okay. question from
And
an
on this
employee.
one, sorry, if somebody listening in knows of some confirmed cases of transmission, actually, please flag it in the Q&A.
Can I share one anecdote?
Yeah.
There's a documented case at a hair salon where two hairstylists who were giving people, haircuts and whatnot. I think it was about 75 people, and the hairstylists were wearing masks. There was 0 transmissions. 0.
They were infected.
The both hairstylists were infected with live virus. 0 infections came out of it.
2 clients. Okay.
That's right.
All right. Adriana?
Okay, so this question is from an employee dentist. He or she says, I've been furloughed for the past 3 months. I have no indication of when I'll be returning to work. What impact do you think that this will be on the 6,000 new graduates that are coming to the workforce this year?
That's a great question. So I'll just review, because we had a slide on this earlier. So you're not alone. Less than half of employee dentists who were furloughed are back in our data. So it's not like the employee dentists are kind of back to normal anywhere close. In fact, they're lagging, right? Now, the broader question of what this will do for that new dentist or new grad generation and potentially even recruits into dental school, to me, again, I guess ends up where we stabilize in terms of the new equilibrium, right? But I would say that I think the effect will be most significant for the youngest dentists and for those that are employees. But I don't know how big it will be. So let's start with Steve B. Do you see, for example, any long-term implications for new grads? There's lots of writing about the new generation of job seekers that are going to have a decade of lost earnings and things like that. Do we see this in dentistry, or we think, if we get back to 95% of normal, the new grads will be fine?
Look, I agree with the view that dental care really is essential. There are very clear documented relationships between oral care and broader health care, and the demand is unquestionably there. So I don't think that there's going to be a structural loss of jobs. It's going to be a tricky year. A good friend of mine who's coming out of residency at the Cleveland Clinic in gastric surgery is having a hard time matching. It's a really difficult time right now. But I think on a medium horizon, not a lot actually changes. It's easy for me to say because I'm a person who sits here and has a job, but it's very scary. It's really frustrating. But on a medium-term horizon, I don't think very much changes, other than I would just echo the sentiment, Marko, that came out of your slides, which is that I think dentistry downstream of this becomes more coordinated and more consolidated. So if we take a view that over time, we probably have additional outbreaks, maybe probably different viruses, I think people are going to feel a lot more comfortable, both economically and from a health and safety perspective, being in an environment like the one that Steve Thorne runs, right? They're doing an incredible job on so many levels. So I think small practice dentistry becomes a smaller component of the opportunity set.
Okay. Actually, we're right up on time. I'm going to get to Ty and Vijay. Steve, I'm going to take that as your closing comment, and I really like that, because I was going to ask both of you, Ty. Let's end with longer term. Let's look beyond the second potential wave. Let's look beyond 6 months, a year. What do you think COVID is going to do, let's say, I don't know, medium term, in terms of some potential big changes that may come, right? Steve talked about practice consolidation. We certainly agree. I agree with that. I think it's going to accelerate that trend that was there. Anything else long term?
I echo the second wave. I do think that with respect to the 10% that you have not opened, and the question is what's going to happen with them, things like a second wave that create additional economic strain may in fact change the answer for some of that portion, and even ultimately affect another piece of it. So we'll be watching really closely on the workforce, but I do think that there will be shifts. It's just how much of it and how accelerated is it.
And Marko, one of the biggest positive developments that I believe will come out of this tumultuous period is the dental industry will fully embrace the digital transformation, which is happening in many other industries.
Okay.
Patient perspective, filling out patient forms, payments, paying from anywhere. You cannot imagine payments in the old way anymore. That's an area which I think was time consuming and inefficient. The whole process of scheduling phone calls and making appointments will be a dying breed. We feel that every one of those aspects, the technology front is going to be embraced in a much better way.
Okay. Okay. Good. Listen, we're right up on time. On behalf of the HPI team, let me thank all of you. We're going to have you back. This has been fantastic. So let's all get together when we have another wave of data. Really, really great insights. Steve B, thank you. Ty, Vijay, thank you so much. Steve Thorne left us, thank him.
Thanks.
Thanks to the audience for staying on. We've had quite great attendance right to the end, and apologies if we didn't get to everybody's questions. But look for the recording, and we'll see you further up the road, and stay safe. Thank you.
Thank you. Bye, Marko.